new perspectives on how to approach issues, problems, and challenges.
Probably the best portions of the program is really the relationships that the individuals create. But they all have a common purpose. They were all selected because they're here for something more than a paycheck. They want to do great things for this organization. They want to do great things for the county. And so when you bring like-minded individuals like that together, the relationships they build are just incredible.
It's about being around people that are high performers and people that can actually get the job done.
It has a lot to offer, not because it gives, but because it extracts value from people. It extracts that hidden desire to be part of something bigger, of actually helping the community.
Together, we are strong. We have grit and tenacity. We have the home field advantage. And when one of us falls, we rally together. Because we are mighty as one. And together we cross all finish lines. Because we are Florida Sports Coast. We are Sports Coast strong.
I'm excited to say that we are Sports Coast strong.
if they read them off.
Yeah, I think that they're gonna.
That's right. You actually usually read the names. That's right.
Emma Miller and
Oh, hold on. Try that, Eric. How about now? Can you hear us now, Eric? Okay. Okay. You can hear us overhead now.
Oh,
Okay.
I wonder if they,
Okay, we just can't hear you. I mean, we can hear you. We just can't see you. Sorry.
can't see us.
Would fix be if their laptops they just log in individually?
They could, yeah. If they have their laptops, they could log in individually into the meeting and we could come in that way if they want, even though the meeting starts in 40 seconds.
Well, except I don't have any board members here.
Oh, that's true. I saw Mariano. We don't have any board members here on this side yet.
Wait, so Dan, you can hear us, you can't see us?
That is correct.
not going through.
Then why is this?
That's not going
So that means the public can't see us either.
What if you turn the camera on your laptop, Eric? Is your laptop still connected to the meeting?
I don't have a laptop. No, I don't have a laptop.
Eric, is your laptop still connected to the meeting?
But why is it not working
Turn on the camera.
I understand.
Just like set it on the end of the dais and face it down the dais so that we can see all the everybody who's on. There you go. I can see everybody now. Unfortunately, we can't zoom in, but we can at least, I can see Commissioner Oakley, I can see Commissioner Moore, and I can see Nikki. If you want to put it closer towards the other end, like in front of Nikki, so that we can see Commissioner Moore and Commissioner Oakley. More. Keep going. Go to the edge there. A little more. Keep going. Go right to that corner. There you go. Now turn it a little bit more so I can see Oakley. Turn it. There you go. Just like that. Okay. I can see both of them. All right, so whenever you guys want to start.
All right.
Okay. And you can still hear us, Eric.
Okay, so I don't see our pic up there. Screen. All right, I'm gonna go ahead and call the meeting to order. Good morning, everybody. I'd like to call to order the virtual Pasco County Board of County Commissioners special meeting of June 29, 2020. I'd like to remind everybody to please silence all electronic devices and mute your microphones. So at this time, I could please rise for the invocation and pledge.
To satisfy the needs of every living creature. Make us thankful for your loving. We must one day give, may be faithful stewards of your good gifts. Amen.
Amen.
United States of America, stand indivisible,
Justice for all.
Before we call the roll, I'm trying to figure out what all that background noise is. That's really, really loud. Hearing it more. It's on that side. Madam Clerk, please call the roll.
District 1, Commissioner Oakley.
Here.
District 3, Commissioner Starkey. District 3, Commissioner Starkey.
I saw her just walk by.
Does it matter? Does it say on there front? No, it doesn't. As long as we get halfway. Yeah, y'all.
All their mics off. Every one of them. Let's call roll one more time, please.
District 3, Commissioner Starkey. Hear me over.
We can hear you. She is not on the line yet. She is supposed to be coming in virtually, and she is not on yet.
Thank you. District 4, Commissioner Wells.
Here.
District 5, Commissioner Mariano.
Here.
District 2, Chairman Moore.
Here. Thank you. Mr. Steinstein, will you please go over today's proceedings with the BCC?
Be happy to, Mr. Chairman. On March 20th, Governor DeSantis issued Executive Order 2069, which has recently been extended by Executive Order 2150, which suspended any Florida statute which requires a quorum to be present in person or requires a local government entity to meet in a specific place. The order allowed the Board of County Commissioners to meet virtually utilizing communications media technology. A detailed advertisement was run in the Tampa Bay Times indicating the board's intent to conduct a virtual meeting. Even with Executive Order 2112, the governor's safe, smart, step-by-step order, large gatherings of over 10 people are not permitted to congregate in any public space that is not readily allowed for appropriate social distancing. Based on this, the conduct of a regular meeting would certainly not meet the spirit or intent of this order. The public is being afforded an opportunity to make public comments either in writing or by use of communications technology that has been provided. The board adopted Resolution 2118 on April 21st, 2020, establishing procedural rules for virtual meetings such as the one being held today. As with any meeting that you take action, you are required to take public comment on any proposition pursuant to Section 86.0114 statute. I'm available for questions.
Thank you, Mr. Steinschneider. So now is the time for public comment. Citizens are given an opportunity to comment on any item coming before the board during the public comment section. The board also takes public comment on items to be placed on a future board agenda or other business under their purview. Due to COVID-19 operations and to safeguard the well-being and safety of our citizens and staff, today's public comment will be handled differently. First, we will take public comment from callers that are pre-registered and are currently on queue. After we read into the public record, comments, documents, PowerPoints, or videos that have been identified by members of the public to be read out loud or played at the meeting, not to exceed 3 minutes for each. This new format does not waive the request that when you address the board, comments are not directed personally against any commissioner or a team member, but rather directed at the issue at hand. This provides mutual respect between the board members and the public. For those participating and calling in, after stating your name and address for the clerk, the timer will be activated and will start a countdown. After 2 minutes, one beep will sound, letting you know that only 1 minute remains. After the time is up, 2 beeps will sound, indicating the 3 minutes are up. Please note the calls will be disconnected at the 3-minute mark. Madam Clerk, I know we do have people pre-registered to speak. I will hand it off.
10 people who previously registered. However, only 3 are on. They registered number 4, which is Miss Christie.
Good morning. Please state your name and address for the record and start your comment.
My name is Christy Shirkey. I live at 3438 Farrell Street, Newport Richey, Florida. My comments concerning the mask ordinance. CDC guidelines recommend masks to stop the spread of coronavirus. Florida is now number 6 in the amount of cases in the United States and have over 3,400 deaths. Our demographics result in Florida having over 20% of the most vulnerable people to get very sick or die from this virus. Our medical community needs our support in reducing the spread so that they may take care of the sick. Also, people and businesses will not thrive until we do contain the spread. Asking the ordinance stand that people wear a mask to show humility, kindness, and respect to our community. Thank you.
Okay, thank you for your comments, Madam Clerk.
Next registered individual is number 6, Donna Bradley.
Good morning. Please state your name and address for the record and start your comment.
Donna Bradley, 3818 Dog Trot Street, Newport Richey, Florida.
Ms. Bradley?
Yes.
Do you have the TV on? If you could mute that before you start your
I
comment.
was listening to the live TV for Pasco. Okay, go ahead. I'm sorry.
Go ahead, ma'am. Thank you.
Yes. What do you need from me?
Your comment for the meeting?
Oh, I thought it was okay. I didn't know it wasn't live. So go ahead and start it.
If you could, yeah, please.
Okay. I'm calling in to voice my support for mandatory mask wearing. My husband and I are in our 60s, and we have an autoimmune compromised child and are also in our home. And I'm one of the main caregivers for a friend who is undergoing chemotherapy. Since Friday and the mandatory mask wearing, I felt a lot more comfortable going back into public places to buy groceries, go to the garden center, the pharmacy, and even local businesses. Research has shown that mask wearing helps to keep others safe from us. It is less effective if others are not also wearing their mask to keep us safe from them. Therefore, voluntary mask wearing will not work. Before Friday, you could go to the grocery store and less than half of the people were wearing their mask. I went to the grocery store Saturday and everyone was wearing their mask. So masks are not 100% effective, we know that, but they help. And why shouldn't we do everything that we can to help others, and especially to help our clerks and our business owners and to keep the hospitals, from overflowing with patients who are getting COVID. Not wearing a mask worsens the pandemic, leads to more disease, and it worsens the economic effect. It is not comfortable to wear a mask in public for any of us, but it is a simple step that we can all take to care about others and to care about our local businesses as well. Thank you.
Thank you, ma'am. Madam Clerk?
And the last individual that is on the line, number 10, Mr. Larry Shirkey.
Hello, please state your name and address for the record and start your comment.
Yes, my name is Larry Shirkey. I reside at 3438 Farrell Street in Newport Richey. And I am asking that you keep the mask ordinance in place. It is an imperative that we all follow CDC guidelines in order to contain the spread of the virus. Thank you.
Thank you.
Thank you, sir. We have one more person that called back into the line, Madam Clerk.
Yes, that is registered number 8, Miss Carla Chernicki.
Oh, it looks like she hung up. If we could hold on for just a second and see if she calls back.
Did she call back? No. Chairman, we're going to try to call her right now.
Hello.
Mr. Nikki?
Yes.
Hi, this is Paula from Pasco County. We're here live on the meeting. We just wanted to get your name and address for the record so you can start your comment during public meeting.
Thank you.
Thank you.
Carla Chernicki, 4423 Cherry Loop, Newport Richey.
Go ahead.
Thank you, and thank you for allowing me to speak today. I'm voicing my support for the mask ordinance in businesses in Pasco County. 25% of new COVID infections in Florida have come in the last 2 weeks. In fact, on June 9th, Pasco County began to realize a rise in COVID infections, and there has been a steady upward trajectory of cases since then. In fact, just a couple of days ago, on June 27th, Pasco County saw 9,585 cases, the highest ever been in Pasco since the pandemic occurred back in March. I've understood that we live in a nation that bases behavior on certain principles, such as love your neighbor. As someone with multiple lung and autoimmune diseases, I have trouble breathing as it is, but I wear my mask and I'm fine. And I must rely on others to display that principle in action by wearing their mask. I wear my mask for others. Their mask is for me. There's an entire political ideology that is intertwined with conspiracy theories and some type of cultural signifier that's going on about masks. It is imperative this board protects all citizens, all lives, and not bend to the will of a few fringe individuals who may not acknowledge known science and hear and acknowledge the advice given by our medical professionals. We can look at other countries to see how they have flattened the curve by wearing masks. And that is happening in more than one place all over the world. So I encourage this board to please continue with the mandatory mask ordinance. Thank you.
Thank you, ma'am. That was our last caller, if I'm not correct.
That is correct.
That's correct.
So we're going to move on. We do have a number of emails, Madam Clerk, and but however, pursuant to the virtual public comment instructions, the emails have been forwarded to the board members, clerk and comptroller, and county administration. Those emails will be submitted as a receive and file. How many do we have, ma'am?
We just have one.
One.
And it was for receipt and file, not to be read into the record.
Okay, great. Thank you so much. And for the record, Commissioner Starkey is now on. There were some technical difficulties. Commissioner Starkey, can you hear us okay?
Yes, I can.
All right, thank you, Commissioner Starkey. Okay, so now we're moving on with the consent agenda. I have a pull sheet with one item listed. That would be C1. Board members, do you have a reason to pull the other item, or can I have a motion to approve the remaining consent agenda?
Move to approve.
I have a motion by Commissioner Oakley to approve.
Second, Jack Mariano.
I have a second by Commissioner Mariano. Madam Clerk, please call the roll.
Commissioner Starkey.
Here. There's a lot of background noise.
Wells.
Aye.
District 5, Commissioner Mariano.
Aye.
District 2, Chairman Moore.
Aye, motion passes 5-0. And I will kindly ask once again, it sounds like we have some commotion going on the other side in Newport Richey for some reason. We're hearing things move back and forth. It's very loud. If the people down low that we can't see, please mute your microphones. Please. It's very, very loud. Mr. Kabala.
Thank you, Commissioner. Item C1 is the assignment of various easements, service agreements, construction contracts, et cetera, associated with the acquisition. During the course of last week, there was an emergency work order issued, and of course, this needs to be added to that. So that is what this change is about.
Any questions for Mr. Kabala on item C1? Seeing none, I'll entertain a motion.
Ron Oakley moves approval.
I have a motion by Commissioner Oakley.
Second, Jack Mariano.
I have a second by Commissioner Mariano. Madam Clerk, please call the roll.
District 1, Commissioner Oakley.
Aye.
District 3, Commissioner Starkey.
Aye.
Thank you. District 4, Commissioner Wells.
Aye.
District 5, Commissioner Mariano.
Aye.
District 2, Chairman Moore.
Aye, motion passes 5-0. Thank you so much. Now we move on to our regular agenda, and it's a full one with one item, R1.
Good morning, Justin Grant, Public Infrastructure, Fiscal and Business Administration. We can pull up the PowerPoint. Fantastic. This is UT 20-0359. This is the supplemental resolution adopting the issuance of water and sewer revenue bonds, Series 2020, not to exceed $29.3 million. Resolution 19-101, authorize staff to initiate the process and final due diligence in negotiation for the transfer of the aqua system of the FGUA aqua system in Pasco County. Resolution 20-048, the board found purchase to be in the public interest, approved the transition agreement, and the board exercised its right to move forward with the acquisition. Next slide, please. Our approach, utilities engaged its financial advisor, PFM, to assist utilities in analyzing its financing options. And then back in March of 2020, we issued an RFP, was solicited out for a tax-exempt fixed rate loan. 3 banks responded to that in a very challenging market condition, as we all know, with everything going on. The ideal respondent that was chosen was Truist Bank, offering the most favorable rate and terms. And the results of the purchasing process determined that the fixed rate loan was the preferred financing vehicle for the acquisition. We analyzed a number of different ways to do this. That was the best that was advised. Next slide, please. This instrument is expected to be effective June 30, 2020, with a final maturity date not to exceed October 1st of 2039. All conditions of the master resolution number 20-15 have been met, and the water and sewer revenue bond series 2020 will be issued on parity with utility debt. Finally, series 2020 is to finance the acquisition of the FGUA aqua system. The not to exceed $29.3 million covers the following. This is the cost of the fees, the utility revenue bonds, series 2013A, issued by the FGUA, payment of any other outstanding obligations of the system, payment of verifiable expenses by the FGUA associated with the transfer of the system to the county, and to fund costs of capital improvements and renewal replacement projects associated with the system. Next slide. That is all.
Anything else?
Yes, sir.
No?
That is all
Questions?
for that item.
Questions from the board? Do you have any questions from the board?
Ron Oakley moves approval.
Commissioner Oakley moves approval.
Second, Jack
Mrs.
Mariano.
Starkey seconds. I think I beat you.
Was that a second by Commissioner Starkey then? Okay. Madam Clerk, please call the roll.
District 1, Commissioner Oakley.
Aye.
District 3, Commissioner Starkey.
Aye.
District 4, Commissioner Wells.
Aye.
District 5, Commissioner Mariano.
Aye.
District 2, Chairman Moore.
Aye, motion passes. Thank you, Madam Clerk. I'm gonna slide this down. Okay. We can proceed with old business now. Commissioner Oakley, do you have anything you'd like to bring up today?
I will just let the commission know that I visited with Sheriff Brady Judd in Polk County the other day and walked through his memorial that they had for the fallen officer memorial going into the sheriff's office in Polk County. And it made me wonder, because it's been about 2 years since they talked about the fallen officer memorial here in Pasco, which I was expecting to be done by now. So I've reached out to friends and found out that they still lack about $80,000 to finish this project. And I've taken on myself and my friend Randy Blankenship and his wife Shannon. We've been calling numbers, and we've gotten 12 people giving $5,000 a piece, and we've raised $60,000 to date since last Thursday.
Wow.
And we will
find some other friends to finish that up and start getting that memorial prepared for us. So it's something I think is very much needed, and it's taken several years to get here. So, but it touched my heart when I saw those memorials and those bronze statues of officers that had fallen over in Polk County. One of them everybody knows about is one officer and his dog. His statue there in bronze, and the dog also that got killed in that, where it made, I guess, Sheriff Gray's judge got famous when he said they ran out of bullets. So, but they were out there to protect that officer and other officers in the area when that convict was loose and made everybody get in harm's way. But those kind of things need to be recognized, and I think this needs to be finished for Pasco County. And I'm going to work until I get it finalized, and we'll have a beautiful memorial right here at 301 and Meridian, one in hopefully near future. So, thank you.
Well, thank you, Commissioner Oakley, and thank you for your supporting that, and you and your Mr. Blankenship and others. Commissioner Starkey, do you have anything, ma'am?
Well, I did want to talk about the mask ordinance. And I do support masking at this time, but the one thing that I would like to see changed is the responsibility. I believe should not be the responsibility of the employer, but the responsibility of the person coming to the business, because I think it's very difficult for the employer to have to be the policeman standing at the door. So I think it's okay to put a sign on the door, but enforcement shouldn't be and fine shouldn't be on the employer or the business owner. It should be on the person walking in the door who's breaking the rules.
Okay. Commissioner Starkey, anything else you'd like to add? Or?
Nope, that's just the one thing I want to change. Thank you.
I apologize to interrupt again, but something's happening in the other office area. It's not on the dais. Not on the dais. It's happening lower. Somebody's mic is on and moving things around, or
NPR BCC board without the D.
It's Madam Clerk, go ahead and just say that louder. Which one is it?
So what I see light up is NPR_BOCC_BOAR.
So whoever that is, I'll ask you to mute your microphone because it's causing hecticity. Yeah, okay. Thank you so much. I will move on. Well, I think, Commissioner Starkey, I think we're going to continue the conversation. If probably may take everything all at once, if that's okay with you. So
yeah,
we'll
I'm sorry. I had trouble logging on, so I didn't know what the agenda was we were to follow this morning other than what we have published. Are we going to talk about that today, or are we going to wait till tomorrow?
No, I think that's, well, since you brought it up, so we will talk about it. I'm just wondering if we should maybe get through everybody, and then we can go back. When it gets to Mr. Biles, then we can have the entire, is that okay?
Yeah, I'm fine.
I think I have a feeling more is going to be brought up, so.
Okay.
Okay, thank you, ma'am. Commissioner Wells? Yeah,
I'm good. I'll wait for Mr. Biles.
Okay. Commissioner Mariano?
My conversation will be the same as Commissioner Starkey's, just with more detail as well.
Okay. So how about I'll keep, is that okay? I'll just keep going around then, and then we can go back to this item. Is that okay with everybody? Yeah. Since it sounds like multiple people want to talk about it. Mr. Biles, do you have anything in addition to the mass conversation before I'll go all the way around and come back if not.
No, sir.
Okay. Mr. Steinsnyder, do you have anything?
No, sir, except it's not a mask ordinance, it's an executive order.
Thank you, sir. Okay. Madam Clerk, do you have anything?
I do not.
Okay. And I do not, so we will go back to the executive order conversation. So again, Commissioner Starkey, I'm going to bring it back to you again so you can restate what you said before, if that's okay.
Yes. I think it's important that we stop the radical large spread we're having right now. I've had numerous conversations with doctors myself and done a little research, and I do think if worn correctly, the mask can help. But I think that the responsibility should be on the person and not on the business owner to follow this rule, to enforce this rule. So that is a change I would be interested in seeing in our emergency order.
So to help along, if I don't mind, Commissioner Starkey, let's go to Mr. Biles and say, talk about the enforcement portion, and then Mr. Biles, and then we can go back to Commissioner Starkey and you can say what concerns you have, if that's okay. Mr. Biles, read the enforcement.
Yes, sir. I'll read it's paragraph 14, if you will. And again, the intent of the order is to seek voluntary compliance with the provisions and educate and warn of the dangers of noncompliance. In the event voluntary compliance is not achieved, then as last resort, a violation of this order is punishable by a civil citation by county ordinance citation with a maximum fine of $250 in the manner specified in the Code of Ordinances. And the code enforcement is responsible for the enforcement of this order. And the reason we drafted it in this manner, a couple of reasons. One, we didn't want to tell businesses that thou shall require everybody to wear masks. The intent of the ordinance is that the business owners know their operation the best, and so they can go through their operation and determine where they have conflicts with respect to social distancing. And in those areas, then that would be the areas where the mask would be required. If you change that over to the individual, that doesn't work anymore. Furthermore, a code enforcement violation doesn't work if it's an individual that we're going to enforce against. Now you're turning it over to it would have to be turned over to a sheriff's violation with a misdemeanor or something to that effect. And we didn't want to go that route either. And working with the sheriff's office, we thought that the best route would be to use code enforcement, because then at that point we can use our education process to get voluntary compliance, and then issue a warning if that was needed, but work with the business owner so that they understood what was going on prior to any type of citation being issued. And again, I understand that there's an issue with, maybe that the only 2 or 3 people working in a business, maybe 17, 18, 19 years old, and the challenge with enforcing that. If somebody barges through and is belligerent and doesn't want to put on masks, we're not going to hold the business owner responsible for that. We will, I'll use the word, apply grace in those instances. What we would like to do is business owners understand their operation. They understand where they would need masks, where they won't need masks, sign those areas and do their best to try to enforce, because this is a health issue, public health issue, enforce that in those areas where social distancing cannot be maintained. And then, again, we will work with code to get the best possible compliance, but, we do not necessarily want to put or create conflicts between either code enforcement and an individual, or sheriff's officers and an individual, just because they weren't going to wear a mask. And so that's why we wrote it the way we did. And we think, based on our discussions over the last week, it seems like that's a really good tack to take.
Good. Thank you, Mr. Biles. I see Commissioner Starkey. Can I ask you a question, Commissioner Starkey? I apologize. I got to learn how to drink water better, I guess. Is your concern when a patron comes into a store and putting the burden on the store owner to enforce it, or is your concern that let's say, I don't want to name a store, so how about I have a big box store, right? I'm the manager, and all my staff members are required to wear the mask. Is your concern of me, the employer, with my employees, or me as the employer with my patrons?
So, for example, we have a market, and our employees are wearing masks, but we don't want to have to station someone at the door and bar entry to anyone coming in without a mask. because we risk having a fine or our business shut down. We see where the governor has shut down some other businesses, and you know, we're just all these small businesses are just trying to stay afloat, and now to put the burden of being, you know, trying to enforce this, it's a lot on a small business. So I think the responsibility should be on the person and not on the business.
Are you okay with being an employer and the responsibility being on you as an employer for your staff, your employees to wear it?
Yes. Yeah.
Okay. So, so you're 100% the patrons then. You're concerned about the patrons.
Yeah, it's the rule that people coming in have to wear a mask. And and for clarification, because I've seen it being enforced differently, and I would say, I guess a store could, or a small business can go further if they want. They could say anyone coming in must wear a mask, and I have seen that. I was in a couple stores over the weekend buying marine supplies, and they had that on. So I put my mask on. My understanding is you have to wear the mask when you get within 6 feet of someone because you can't socially distance. So I do want to make sure we're making that, we have that distinction. There was another point I wanted to make. Ooh, I should have wrote it down. But yeah, I just think the responsibility should be on the person and not on the store owner. And here's the other question I have. How many code enforcement officers do we have? And this citation, if we can't issue citations right now for all the junk people have all around their homes and all the violations I'm seeing up and down in my district, gosh, there was a store that I've called in on so many times on 19 that is a junk store, and they had their stuff all the way out to US 19. And obviously no one's doing anything about it. And I heard we can't do the citations because the courts are closed. So how does this work on enforcement of this issue as well? Just kind of curious on that.
So that's Mr. Bob's question.
Yes, sir. So Commissioner Starkey, the intent for the next week or two is to do education and try to get the business to come to compliance voluntarily and not go down the route of the code enforcement citation. So that's the intent for the next couple of weeks. So I mean,
Dan, what do you mean by get the businesses to be more? What was the word you used? What was that word that you said? To get the businesses to be more
compliant. I mean, the intent over the next couple of weeks is to continue to educate and to do voluntary compliance, which is what code does best. I mean, 94% of the violations that code goes out to are resolved voluntarily. They do not result in citations. And so that's the goal, to get voluntary compliance to the best of their ability. And again, the business owners know where they have conflicts with social distancing and they know where they don't. And so they can set up areas where, okay, you need a mask in this area, but you don't need a mask in this area. We do the same thing, here in the government center. You need a mask in the lobby, but you don't necessarily need a mask in the individual offices, and so on and so forth. So, that's the intent.
Do you have any other questions at the time?
I'm going to guess that we have not written any citations then.
I haven't talked to them today, but I don't think so. The intent was voluntary when we go out.
Commissioners, Todd Bailey, Acting Assistant Administrator for Development Services. We have not written any citations to date as we speak, but we have given a lot of educational warnings, and we have about 20 code enforcement officers out there. We have been doing commercial building sweeps. They are able to cover all of the commercial businesses in the county within several. I think it took them 3 days in March when we did the first initial educational sweep. They have it well within their wheelhouse to handle this, and as the need arises, we're addressing them and only issuing educational warnings, but the businesses are complying with everyone that we have addressed.
Thank you, Mr. Bailey. Commissioner Oakley has a question.
Not necessarily
Or a
question,
comment, I'm
just
sorry.
statement. Ever since COVID has started, we've been following the CDC guidelines, and in there it has been speaking of masks as recommended. I can tell you at that point in time, from that point till we issued this order, we never got any full acceptance of wearing masks. And you'd go in businesses and probably less than half the patrons in those businesses, grocery store or wherever, have been without masks. Since we've issued the order, the businesses I've been in and the signs on the door, your acceptance in here with a mask only. And every time I go into one of these businesses now, whether it be a drugstore or your Publix or wherever, everyone in there has a mask on. So the fact of it is, the order is to make us do what we should take responsibility, each of us, to do anyway, to protect ourselves. And I've found that the reason for this order is so that we are protecting our employees, all of our first responders, and all of our citizens in Pasco County. And we feel at this time with COVID cases rising, that this is what we need to do. None of us want to shut down businesses to keep people from being socially distanced in these issues. So this is why it's like it is. And I've found that in these businesses where I see masks all the time now, people are abiding by it. And I think that's a good thing. It's very responsible. I do the same thing. If I go into business, I put that mask on. It's not too much to ask, even in a restaurant or where you go in, if you put that mask in to go in a restaurant, you go in that restaurant, they're going to social distance your party from anyone else in there. And within 5 minutes, you take that mask off. And when you leave that restaurant and get it back to your car or however you go, then you take that mask off. So it's only a small period of time when you go out to go in a restaurant. And restaurants, I think, are doing a good job. So the order the other day came out where the bar issue was the real problem, because there was no social distance in some of these bars. And a lot of young people and a lot of cases in young people have been on the rise. And that's a big part of the rise that we're getting in the county for COVID cases. So I just want to make that statement.
So yeah, thank you so much, Commissioner Oakley. And I'm going to jump in a little bit too, because I had, and I discussed this with Mr. Steinschneider before sending this out. We sent out a packet to each one of the commissioners, county attorney, and Mr. Biles and some staff, and it has a table of contents. And I just wanted to go through some of these things. You know, when this came about last week, there was a pretty strong response from a lot of the people in healthcare in support of this happening. The first one you'll see in your pack is a letter of support from Advent Health. And with that letter of support, there was an email, and it says, Commissioner Moore, I want to take a minute to salute your collective decision to implement an ordinance for universal masking in Pasco County. I wanted to share with you a letter of support. Please use as you see fit. Please let me know if you have any questions, or we can show our support of county leadership in additional ways. Again, I won't read through all the letters, but basically you have it, and that was signed by Bruce Bergam, SEO Acute Care Services, Eric Wangness, President and CEO of Advent Wesley Chapel, and Amanda Maggard, President and CEO of Advent Health Dade City and Advent Health Separate Hills. There was also a letter from Baycare stating that masks should be worn at this time, and that was by the Chief Medical Officer of the entire Baycare Health Systems. There was also a statement put out by the state of Florida Department of Health, a Public Health Advisory, which did state that all individuals in Florida should wear face coverings in any setting where social distancing is not possible, unless one of the following is applicable, which is part of the order. FMA, which is the Florida Medical Association, put out a statement urging local municipalities and counties to adopt regulations requiring the use of masks in public spaces. There was a number of 1, 2, 3, 4, 5 letters from physicians. And if you look at the letters from physicians, if you can look at, I'll pull Dr. Todd Yontek's. makes 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27. I think it's about 27 references of evidence of support. And I mention that because when things are done, you know, these, and I mean, 8, 9 days ago, I wouldn't have been in support of a mass executive order in Pasco County by any means. Things change and they change quickly. When you go from 2, 3, 4, 5 cases a day to having 305 in a day, things change. We've been very, very good here in Pasco County, in my opinion, of not overreacting to things. We did not do a stay-at-home order because it wasn't justified at the time here in Pasco County. Obviously, we followed the governor's order when he did a statewide order. We've been very, very thoughtful in how we move along. And not over, you know, and I will say, not overreacting to the past by any means. And some of the things that happen around the state, I'll be honest, I didn't like people, they were politicizing it. This is not we have not made this a political issue here in Pasco County whatsoever. Now we know some areas did, and I'm not naming any, but some places across the state, cities and counties, made this political issues and made them political battles. We have not done that. And I know that we've talked about this numerous times, especially on the calls that we were on previously, where most everybody on the commission was saying, hey, what a great job, you know, our health department's doing, what a great job our county administration is doing, what a great job FASA and his team is doing. And I know everybody said how much they appreciate what they're doing. And not once have we had an instance where you actually had the Department of Health, where you had FEMA, where we had multiple hospitals, where we had multiple physicians actually reach out and say, we need you to do something. We need you to do something quick. So I don't think that's overreacting when you actually have the Department of Health making a statement that something needs to happen. So I tend to listen to the advice just because of my background of healthcare professionals, scientists, you know, whether it be physicians, epidemiologists, whatever it may be. I mean, most of you know that I do have a background in healthcare. So, you know, when there's a doctor's order, we always follow the order. And that's what we did. And we did it multiple times on a daily basis. We were following doctor's orders. We could not go against that order, and we had to trust that physician and the decisions that they were making. Now we have a situation where you have the whole Florida Medical Association, which is thousands and thousands of physicians that are involved that are stating something had to be done. You even had some, again, I tend to listen to, you know, evidence-based research versus just politicians and bureaucrats. And I think that's what you should be doing. But you do have some politicians out there, people in the political world. Senator Marco Rubio said on Wednesday, everyone should be wearing a mask to prevent the transmission of coronavirus. That's states across the county report troubling surges. He went on and said a lot more. Senator Scott also made, that was Senator Rubio. Senator Scott's also made statements last week too about you're going to have to wear a mask. We have to wear a mask. He stated that. Even Governor DeSantis in his statement thinks that it should be done locally, but his statement, we provide education. We did an advisory at the beginning of May, and we advised that it's something that could make an impact, and he's leaving it up to local municipalities or counties. April cases 206, May cases 134, June so far 1,392. I would say we have a issue when it's being obviously spread out, the community spread now. It's a difference from what it was before. We actually have community spread in Pasco County. Nobody's denying that now. If you deny it, I guess you're not reading the numbers very closely. So I ask you to read these letters. I'm not going to read them all. Take a look at what happens, what's coming from actual physicians and from the Department of Health and from Florida Medical Association, which is made up of physicians. That's all I have for now. Anybody else like to add more? I see Commissioner Starkey waving.
Yeah, I sent to you guys a very in-depth study that Stanford just did. They just published it last week. on mask research. And I think I'm not sure if I sent it to everybody, so I'll make sure everybody gets it, but you can just Google Stanford masks, and it really goes into great discussion on these 3-ply masks and how good they actually are. Because I know some people say, well, these masks don't help. No, that's not true. And here's the scientific research to show that. So I agree with you, Commissioner Moore. I think we've been very conservative in our thoughtful process during this epidemic. We have reached a stage where we had massive spread that came very quickly. And I don't think it's any of our intention to have this emergency situation for a long time. We hope that our citizens will comply and help us bring these numbers back down to where we don't have community spread. It is not that difficult to wear the mask. It really isn't. You don't have to walk around outside with it. I heard people, I got letters saying they're going to pass out because they're walking around outside with it. No, that's not what you need to be doing. You just need to wear your mask when you're in close proximity to other people, and keep your social distancing and remember to wash your hands. I do think we should improve on our messaging as a county. I asked the administrator, because I think he does a great job, to do another some Facebook posts, Facebook Live or whatever you call those. I think we need some good PSA, 1 or 2 minute shorts to go out and explain ourselves better, why we're doing this. I think that would be, I wish we had done that before we did this order, but I think Mike did one. I actually haven't even seen that one yet, but I think we need to be spreading them more and just being out there a little more publicly about why we're making the decisions that we are. And I think our citizens also need to know, we were in discussions about whether we should go to this order or not. And I know I gave the thumbs up. Yes, I see the numbers. We need to do something to stop the community spread before it gets much worse. Because I think if we all behave correctly, we can stop this before we get to average percentage positives, in very unhealthy numbers. We've been hovering around 2%, which is great. But if you take the last week, I think we're 13, 14%, which is not good at all. So yeah, the long-term average is low, but what we're in right now is very high. We want to get that down below 5, back down to 2, or nothing if we can. So I support what we're doing. I just didn't like the responsibility being the business owner. I thought it should be the person walking into the store, but I'll leave it there.
Thank you, Commissioner Stark. I know I have Mike Napier on the phone too, and you made a good statement. One of the things I'm scared, what really, really scares me is that we go backwards. So many small businesses were hurting, obviously when they got closed. Some of them never made it out. And I also, besides protecting the health of the community, I think we need to protect the health of our small businesses out there. And personally, if we go backwards and they go to a phase 1 or a total shutdown again, it's going to be bad. Really, really, really bad.
We don't need that.
We don't need these small businesses having to close again. Again, bars got closed last week. There was supposed to be a brand new brewery in Pasco County that was going to open this Wednesday. Now, I think they still are to sell growlers, but guess what? They're opening, and you think they're going to be able to make rent? Come on. There's no way. And we can't have that happen again for these poor business owners. I mean, hospital admissions Friday, 11 ICU, 59 hospitals. Saturday, 12 ICU, 70 hospitals. Sunday, yesterday, 16 ICU, 80 hospitalized. Mike Napier, are you on the phone?
Yes, sir, I am.
Okay.
And if I can, I could just provide a couple bits of information. First, I called and spoke to the Surgeon General this morning just to get the latest before this call, and he reassured me and wanted me to reassure the board the importance of the wearing the masks, and was glad to hear that we had done that. I do want to point out that we are at 1,909 cases as of today. That means that 50% of our cases, 1,053 cases, were all in just the last week. Staggering numbers. Commissioner Starkey mentioned that we're at almost 14.5% positivity rate. We peaked at 1,674 test results coming back in, and we had 302 of those people of the 1,672 that came back positive. So we do have widespread cases out here. I would also like to mention, as the Surgeon General also mentioned, we have the 4th of July weekend coming up. And if there is some evidence that the Memorial Day holiday is where we had a lot of people gathering, and that perpetuated the cases. And if we don't put something in front of the 4th of July holiday weekend, that we could see I could have never guessed that we would have had 1,000 in a week positive. We could see 2,000 a week if we don't do something to stop the spread. So I am in full support of what the executive order was put out, and would continue to provide information to you all to make good decisions for our community.
Thank you, Mr. Napier. Anybody have anything to ask
Mr. Chairman?
Mike? Is that Commissioner Mariano here?
Yes, sir.
All right, thank you, sir.
Thank you. I guess you couldn't see me, so anyway, I got a few questions as far as, or a few comments to make as far as what's real, what's not real. I think we all heard Dr. Fauci probably a month ago saying, don't wear masks, they're not good for you to wear. Now there's a change. CDC, I've got 2 doctors that responded to 2 of their patients asking about, should I wear a mask, should I not wear a mask? One of them I saw late last night that was posted, and it says, this is the doctor to his patient, follow the CDC recommendations for using a face mask. And it says, first colon point, CDC does not recommend that people who are well wear a face mask to protect themselves from respiratory illnesses, including COVID-19. Face masks should be used by people who show symptoms of COVID-19 to help prevent the spread of the disease to others. The use of face masks is also crucial for health workers. So again, it's not helping those that don't have anything. And if you don't have it, it's not doing anything. The other thing is, when I look at the MASM data, when you look at the N95 mask, it protects stuff from infiltrating that person, but with the exhale, it does nothing to protect anybody. So you may have it, you're going to exhale it out, and even if you're protecting, that's still going to go through the mask and get out in the air. The cloth masks, people say just don't protect anything. Surgical masks, those are set up for sterile environments. So when you get the amount of particles, contaminants in the outside and indoor environments where people are clogging these masks very quickly, the moisture can be trapped in there. You can trap it and actually become your own worst enemy, breathing them in carbon monoxide in, but even bringing that virus back into your own system. Having said that, I thought was, I won't say perfect information, but I thought it was pretty good. The Swiss policy and research, it was a long document, had a lot of good information in it, and it talks about how the Swiss had not gone through all the same things that we had gone through, and they actually did fairly well with it. And I haven't heard anybody mention anything about the NBC News report last night that came out with like so many thousands of tests that would come out, they came out inaccurate. I know of one person that was actually tested once positive, once negative. So what is the validity of these latest set of tests that are out there? I mean, I was watching 60 Minutes last night and talked about how maybe we allowed too many test kits to be sent out that were not approved by the FDA. And maybe these are some of the kits that they were using. And now they got to go retest all these people again to find out what the actual numbers are. So maybe part of the spike we're getting is going up. Hadn't seen anything about as far as deaths going up. And if that's been going on all this time, haven't seen any data to that. I don't think we should be making it mandatory. I think if you take a look at what we could do, make it the voluntary. I don't see how code enforcement is going to go in and enforce these things to different business owners. I don't know how we feel the authority. And frankly, I will say I don't really like the fact that when we had the discussion, or I'll say my conversation with Mr. Bowser, I wasn't supportive of this, and then to see it all of a sudden get implemented, I think should have been a board decision from the get-go. I think this board operates very well with discussions, with information that gets out there. To have our administrator make this decision, which is very impactful amongst all our small businesses that are out there, that may get people just because it's going to be mandatory. You may give false protection hopes that are out there, knowing that this COVID-19 can go through these masks and not going to protect people as much as you may think. I would like you to discuss, Dan, again about how you're going to go enforce this with code. And Mr. Starkey, I share your same thing. I see code violations all over the place. If they can't handle that, I'm going to go throw this back on them. And if not, I'm going to take the sheriff's department and get them involved in it. I mean, I think we got a lot of responsible people, and I think everybody's paying attention to these numbers. I think if you give them a chance, you're going to see a lot of people wearing the mask. But to forcibly put it and then put these businesses under extra burden to do enforcement of our code, or even take our own code people off their regular duty to come back out. I mean, you're going to have them come out the next day, that night. How are you going to make this work, Mr. Bowles?
So, to commit, Mike, you're on to the
Yeah.
CDC.
Just the one thing I would say, Commissioner Mariano, I did see that doctor's orders. My guess is that was an old recommendation. That was a form letter that they were sending out. And you are correct, Dr. Fauci did indicate that several months ago, but reviewing that record, I can't tell for sure it was a current record, but it is an old recommendation. And I'd be happy to follow up with that physician on reviewing his recommendations on not wearing a mask.
If I could, then let me tell you about another doctor. I told you I had two. This is a note that I got from a person, messenger, and it said, Mr. Mariano, my young doctor told me 100% of us will have been exposed to the COVID by this December. 70% of us will be asymptomatic. About 21% will have short-term symptoms. 9% will need treatment, not necessarily hospitalization. His parting words to me were, get back to the gym and no mask. And then she makes a comment, guess I can't follow my own doctor's advice. This was current, not old.
So, Commissioner Mariano, can I ask you, because you see the documents I gave you guys from physicians that were signed letters from the physician. What physician was that? What's that physician's name? And where's the letter?
I don't have that information yet. I just got it as a blank thing from a person and haven't been able to ascertain all that. The point is, there's definitely conflicting that's information out there. And for us to go make a mandatory statement, we don't know what the actual facts are. Even the CDC has changed their own position. Why would they change their position?
No, that's not true. I am looking at the CDC website right now. And the first thing it says is the CDC recommends that people wear cloth face coverings in public settings when around people outside of their household, especially when other social distancing measures are difficult to maintain. Cloth face coverings may help prevent people who have COVID-19 from spreading the virus to others. Cloth face coverings are most likely to reduce the spread of COVID-19 when they are widely used by people in public settings. And then it says children under 2 should not wear them. And then it says evidence for effectiveness of cloth face coverings. Cloth face coverings are recommended as a simple barrier to help prevent respiratory droplets from traveling into the air and onto other people. The whole front page of CDC is saying wear a cloth face mask. So I think you might have there, Jack, is something very old.
Well,
because they are recommending this is updated June 28th of 2020.
And Commissioner Starkey, I don't doubt what's on there. I was actually on the site myself, went through the whole thing. I actually asked him a question too. I haven't got the response back. I said, if I've got doctors that are saying to their patients, follow CDC guidelines by not to wear a mask if you're healthy, then why did it change? And when did it change? I haven't got a response back from that yet through their, ask questions section yet.
All kinds of.
I agree. And remember, the key word there is may. And from what I can see from the different tests that are out there, different things that are out there, and we all heard different things. I'm sure we've got lots of information from other people. But the air that can go through that, yeah, it's going to stop the saliva, the droplets, the spit that may come out with someone. But the air that goes through, if that COVID virus is going right through that mask, it's not going to protect that of the people beside it. It'll help on certain things.
That's not what the scientific data says. And it says right here, This recommendation is based on what we know about the role respiratory droplets play in the spread of the virus that caused COVID-19, paired with emerging evidence from clinical and laboratory studies that shows cloth face coverings reduce the spray of droplets when worn over the nose and mouth. And one of the studies that they probably are looking at is that very, very good study that I sent you from Stanford University that actually is showing that a properly made 3-ply mask with a cotton poly exterior, a filter in the middle, and the cotton next to your mouth, you can breathe very well. You don't get trapped oxygen in there. And they're saying it's better now than a surgical mask. So I think they've come out with a lot of data on masks because of COVID-19 that will change the face of medicine. So I would be, I'm really suspect when you get something on the internet that has no backup. I mean, there's aliens landing, 9/11 didn't happen. There's lots of junk on the internet, and I think you need to be really careful.
And Commissioner Starkey, that's why I'm trying to get all the information I can from all the sources I can and getting the backup when I can as well. And again, as you just said, if there's a better mask that's out there, I will tell you the people are walking out there with cloth masks, surgical masks, N95 masks, aren't providing the same protection that sounds like the mask that you're saying. So to expect people to have a false sense of security because they're wearing a mask and the person across from them, when the disease can still spread to them, I just think it's, if we just get off mandatory, strongly recommend, I think we'd be in much better shape.
Well, Commissioner Marion, I'm going to go back to that article you stated you were talking about on NBC. That was actually News Channel 8 is what you're referring to. That was actually back from May. That was going around Facebook again yesterday. So that article is well over a month old. It's not new. That was in relation to the ones that happened at Advent, which we were all told about by Mike Napier on the phone a month and a half ago, probably. So that's not a new article. That is an old one. And so, I'm just going to say kind of what Commissioner Starkey, going back to her, is, why are these physicians, why are these hospitals stating this? And these are ones with their name signed to it. So I appreciate you said some physicians. Show me a letter. Show me a name. Show me a signed letter from one of those. These are all signed letters. There's 100 more physicians or 200 more or 500 more that would do the same thing and say the same thing. So, you kind of got to bring something that shows proof that they're actually stating that. Three hospitals, actually more than 3 hospitals because Baycare is a very, very large system. So multiple hospitals and multiple physicians. I talked to an ER doctor and he went from his hours being cut down, which all ER doctors did for a long time because of the surgeries and stuff, to he can't believe how many COVID positive cases he's seeing in the ER now. It's really bad. So I know Mike talked about, you're doubling almost every day hospital admissions and ICU cases. And that's what we were all worried about. Remember the whole time we were talking about before, why we did not do a stay-at-home order. Why we did not do a stay-at-home order? Because those hospital admissions weren't there. The ICU filled beds weren't there. And now it's doubling every day. Listen, I just follow science. I follow physicians, and I think, if we leave it up to politicians or bureaucrats to be scientists and they're not, or be physicians and they're not, we're getting ourselves in a world of trouble.
Mr. Chairman, let me ask a question. Hillsborough had passed one and they're getting sued now. Do you think that we're going to be looking at the same lawsuit coming up?
Well, I think I think our order is different and how it's done and what they're focusing on is different than how this order is written. Mr. Biles or Mr. Steinsider, I think, can speak to that. It's not written in the same manner as theirs, and where I think that suit may be focusing on. I could be wrong, but Mr. Steinsider or Mr. Biles wants to respond.
Mr. Chairman.
Yes, please.
I'll be happy to respond. Ours is very similar to Hillsborough County's. One of the lawsuits that Hillsborough County has drawn, there are 2, attacks how it was adopted. In that respect, we are not at all like Hillsborough County, just because we don't have an EPG that is the way theirs is constituted is different than our what we do. The Sabatini, Representative Sabatini lawsuit that he has filed against Hillsborough, Leon, and Orange, and the one that was filed against Hillsborough, that does not go into as much as how it was adopted. But it's also very similar to the lawsuits that were filed against Alachua earlier this year. And the cases, the orders which have come out of the Alachua litigation have upheld their mask ordinances. Granted, it's process, but the initial emergency injunctions that the lawyers took against, two different plaintiffs took against Alachua County, both in federal and state court, were found were the emergency injunctions were not put in place. So will you draw a challenge? Probably. Am I comfortable with defending it? Yes.
Okay. To give a little answer back to as far as where I got the information as far as the doctor's orders, and I'll just read you what the quote came in. I'm not sure what hospital it's from. My cousin in North Carolina posted it last night. I can try to get a hold of them and find out. It has yesterday's date on it in their upper right corner. So I'll dig the information out as best I can for at least for tomorrow's meeting anyway. But I will say that I really, again, back to having our administrator make the decision as opposed to the Board of County Commissioners, I don't think this is the right way to do it. I think we should have had a COVID meeting, if nothing else, to talk about specifically this topic before they actually pulled the trigger.
Well, I mean, I can appreciate your statement. We do have a policy where we give the county administrator the powers under emergency order to do those things. The reason being, and if I'm not correct, Mr. Steinschneider, is so you don't have to wait on certain things, whether it be this circumstance or a hurricane where something needs to be done very, very fast. He does have that. He or she, depending on who the administrator is at that time, has that obviously ability under our policies. If you want to change policies in the future, that'd be something we'd have to have a long discussion about, obviously.
You're correct. The ordinance, this is, you are acting in the ordinance does allow the board to delegate that authority to the administrator, which they did in this case. It's really no different than the administrator issuing a curfew order or a evacuation order during a hurricane.
And again, back to, I didn't say he didn't have the authority to do it. I just didn't like that he did it. I think it should have been done by this board. We had all these weekly COVID meetings 2-3 times a week. We ended those, and then to go all of a sudden have a change. This should have been done at a COVID meeting. We could have at least discussed it, gone through it, and dissected before pulling the trigger.
Okay. Commissioner Wells, please.
If I could, I'll be brief. And I told
Your mic's off. There we go. Yeah.
Can you hear me? Okay,
Yeah.
I'm trying to use the one over here because I think the other one was the issue. I totally support Mike and Napier and Andy and Dan and their team with this. Obviously we see contradicting things on everything, but I've got to go off our team and what they're telling us. And I respect the heck out of Mike, and he's been very conservative through this whole thing. So when he said that we need to do something, I get it. I do agree with Commissioner Mariano. We really shouldn't be making this mandatory because code can't even do their job as it is now. I can tell you, like this morning, I went to a restaurant and had breakfast at 7:30. And this is where we didn't do a great job rolling it out. We definitely could have done a better job. I know I've spoken to Dan about that, and I know Commissioner Starkey brought it up, is like the exemptions. If a business, including a restaurant, can operate under CDC guidelines, which they can, you really don't have to wear a mask to walk into the restaurant to get your table. You can still stay 6 feet. I just know I personally saw folks walk away today upset, didn't want to use the establishment. I don't like to see that. Did I have an issue wearing a mask to go to the table? No. But again, I think we've got businesses like the business I was at this morning and others, Publix, for instance, you shouldn't have to wear a mask in Publix. You can follow CDC guidelines in Publix. All the employees wear them. This is where it's kind of catchy to me because, again, I get it. We don't want to see more lives lost due to this, but again, I think if businesses can abide by the CDC guidelines, which are pretty specific, that's the only issue I have. And like the masks, I know we're giving one mask a day. How long is that mask really good for? You know, I know the ones I have in my office are made in China. I assume they're good for one use, and that's it. Mr. Biles or Andy, or you would need to come up to the mic, Andy. But I just curious, like if we're only going to give somebody one mask and it's only good for one day, that doesn't make sense. So I'm just asking the question. So.
No, sir. The masks, the cloth masks that are being issued to all county employees and are good for 15 uses. They are washable. So you can use them, excuse me, for a period of 30 days with 15 washings.
And these are the same ones we're giving to the residents.
Yes, the Hanes, we're giving Hanes, that's a different brand, and that's the same way. They are actually the same usage.
I've had people ask me, again, those are questions, again, the CDC guidelines. To me, it's pretty simple. I know before businesses didn't necessarily have to wear masks, but most of them did, you know, so.
So with those masks, when we hand them out, when the businesses come and pick them up to distribute to their own employees and their customers and the public, if they're a point of distribution, they're given a form sheet that they actually take back with them, and it describes everything about the mask, the usage of the mask, and it gives great detail for it.
Mr. Chairman?
Yes, please go ahead.
Just something else I was reading from previous notes about looking at masks, and it says mayoclinics.com, N95 masks don't prevent the wearer from spreading the virus. Unfiltered air is released when the wearer exhales. That's for the N95 mask. Just a little clarification.
Yeah. So I guess that question, why do physicians and surgeons wear them and during surgery if they feel something's gonna get spread? I would ask that to a surgeon and see how they would respond. Because does that mean they shouldn't? Does that statement mean that not what you said, sir, but what you read basically tell surgeons they don't need to wear masks during surgery now?
That may be a surgical mask is different than this N95. I don't know if the surgeons wear the N95s, but again, it protects the air coming in. It doesn't protect the air going out.
I remember one of the concerns with CDC in the beginning, and that was the health. I think Mike, you could jump into the health department was there was the fear that the healthcare providers would not have masks and have face coverings, and they were asking. And I think we all remember that because we had those conversations on those calls to save them for those healthcare professionals because it was so unknown if there was going to be a really quick outbreak or not, if they were going to need them. But I think that's why. I don't think that's why CDC, one of the reasons they stated they changed and said people should be wearing them now. Again,
Commissioner Moore?
I'm sorry, let me just finish that sentence if you don't mind. We've been very, very conservative in how we've done these things. And we continue to, the health department has, Mike has, our team has, Dan, Fossa, everybody's been very, very thoughtful in this. But again, I tend to lean towards physicians and what they're asking and what they're stating, especially when it's evidence-based. And they don't make statements unless it's evidence-based. They go to school for a long time. So I'm more apt to listen to somebody that's gone to school for 8, 12, 16 years, depending on what their specialty is, when it comes to these issues like this. Especially, again, you saw on some of the things they sent to us. I mean, the letter from both Advent and Baycare takes you to, well, at least the one from, I think both, but maybe it was just Advent, takes you to the Lancet, which analyzed 172 studies from 16 counties. 16 countries. Sorry, I said 16 counties. I apologize. 172 observational studies from 16 countries, and that's where they're getting their data from. So it's not on a whim.
But think of those studies aren't pure.
Pardon me? Go ahead. What'd you say, Commissioner?
If they're looking at studies that others have done, it's not a controlled scientific experiment, is what I'm telling you.
I think you need to read the studies. The ones that these physicians sent, in the 18 or so that one of the physicians sent, I would you. I do my due diligence. I would ask you to maybe read the same thing and then come to a conclusion after that.
I will do so.
Commissioner Moore?
Commissioner.
Yeah, I'm
Sorry.
on the Mayo Clinic website where it talks about how the CDC did an about face and they are recommending that you wear masks on the Mayo Clinic website. And they go into each kind of mask and why it's good and why it's not, but and they tell you how to wear it correctly. So the Mayo Clinic is suggesting that you wear the mask.
What does it say about the filtering of a cloth mask?
What it says is on an N95 mask, the kind that has that little filter that allows you to blow out, it's not good because if you're symptomatic and you don't realize it and you're out, you could be blowing out the virus. But on a cloth mask, it says cloth masks should be worn in public settings where social distancing measures are difficult to maintain, such as in grocery stores and especially in areas of significant community-based transmission. And then it goes into some pointers. Don't touch your mask. If you accidentally touch your mask, wash or sanitize your hands. Remove the mask by untying it or lifting off the ear loops. Wash your hands immediately after removing your mask and regularly wash your mask with soap and water in the washing machine. It's fine to launder it with other clothes.
Okay, thank you, Commissioner Starkey.
Yeah,
I'm fearful. I'm fearful of these businesses. I would hate. It would be just the worst thing in the world if they had to go back to stage one, or they actually institute another stay at home. That would be detrimental. It would just put so many people out of business. I don't think they can handle so many of them, especially the small ones around here. They can't handle it again. And if they're saying it might work, I don't. Any further discussion? If we're going to do anything, today's the day and not tomorrow. It was already brought up. We're not moving this on to tomorrow. So
I'll make a motion. We change the verbiage from mandatory to strongly recommend.
I wouldn't mind seconding it, but there's obviously three of you that are in favor of keeping it, so I'm not going to second it. But I do agree with Commissioner Mariano. I really think that, again, we should. It's just tough. It's tough on those business owners for us to go out and try to cite them. I know we're not doing that, Dan, but I think the verbiage could have been a little bit different.
So I did not hear a second, so the motion dies without a second. Or anything else that we'd like to bring up, Commissioner? Anything else about this item that we're discussing now?
I'd just like to thank the board members for talking about it intelligently, going through and getting the information out there. I appreciate it. Thank you.
Thank you, Commissioner Mariano.
There is one more thing on that. Yeah, there's one more thing I do not like in the emergency order. That is the number. There's a phone number on there to kind of turn in somebody. And I don't know, that made me, I got some comments on that. And I thought, well, I'm not sure if that was necessary that we turn everybody into enforcers as well. So I wouldn't mind taking that out.
Okay, explain. Okay, Commissioner Starkey. So there's a number.
There's a phone number.
Posted. It was the code enforcement number, if I'm not correct, right?
I don't know.
I don't believe the order has a phone number in it.
Okay, so the order itself does not have a phone number. The order itself, Commissioner Starkey,
it may have been
viewing it, but he does not see a number in the.
Yeah, Commissioner Moore, this is Dan. The FAQ that we put out has the customer service phone number on it, so that if people want to call with questions or have questions about how it's being implemented or want to get a comment or complaint, if you will, to code, that's a route to do it. But it's not in the order, it's in the frequently asked questions that we put out.
Okay, well then I'm okay with that.
Okay. Did you have anything else to add, Commissioner Starkey?
No, that's okay if it's in the FAQ and not in the order. I did receive some comments, maybe you guys did too, about turning other people in, which is a little harsh for me. But if it's only in the FAQs and it's for them to get more information, I think that's legitimate.
Thank you, ma'am. I think what County Administrator Biles stated earlier was, and I think it was Mr. Bailey too, what they've done so far is really focused on education, because, you know, there's the circumstances, for example, and I'm just going to use an attorney's office as a great example. You know, they have separate offices. They can maintain 6-foot distance. They're not required to wear them, for example. There's some retail establishments that don't have many customers, even though they do retail type businesses, but they're more of a production based business that has a retail desk or something. They're able to maintain it, and there's not maybe just a few customers coming in a day. From my understanding, they would just they put one on when they have that direct interaction with that customer if they're doing a point of sale or something. Is that correct, Mr. Biles?
That is correct. That's the reason we wrote it the way we did, so the business can look at their operation and make their calls to where they think they're going to have conflicts with respect to social distancing. And in those areas, you know, either have their employees and our customers wear masks. But that's why we wrote it the way we did, so that the businesses could make that determination, because every one of them is a little different, and we wanted to give them the ability to do that.
Yep. I know on my side of the town, my side of the county, my side of the county, before there was any type of executive order, every eating establishment I ever walked into, every server or host or hostess was already wearing them.
Patrons weren't there.
Yeah, not the patrons, obviously, but I know the staff, they were. I actually went in a few places, like Commissioner Starkey said, before this took place too, and they actually had notes you weren't allowed in actually unless you were wearing one. Quite a few actually on the east side of the county. I think Costco was one too, right? Wasn't Costco doing that too? I don't have a Costco membership, but I heard that. Anything else? If not, we're adjourned. Anything else? Seeing none, we're adjourned.